Very good afternoon and a warm welcome to all our viewers. I'm Dr. Shital from the Clinical Engagement team here at DocPlexus. Welcome to our KOL interview on leprosy. As per WHO data, 1,27,558 new leprosy cases were detected globally in 2020. Despite advances in medical science, leprosy continues to be a public health challenge, especially in tropics. The ecology, transmission, and pathogenicity of the incriminated bacilli remains to be poorly understood. In addition, during the COVID pandemic, the implementation of leprosy prevention program was severely hampered, resulting in fewer new cases detected in 2020 than in 2019. This emphasized the need for continuous implementation of leprosy control activities, including monitoring and prevention programs for the global eradication of leprosy. More on this, we have invited Dr. Ramji Adkekar. Dr. Ramji Adkekar is the Assistant Director of Health Service, Public Health Department, Maharashtra. Dr. Ramji Adkekar has been a major contributor in detecting leprosy cases in Maharashtra on his mission to eradicate leprosy. Government took a cue from house-to-house survey from COVID-19 and used a similar strategy for detecting patients with tuberculosis and leprosy infection. He also has numerous papers to his name. We welcome you to DocPlexus. With your permission, let us begin this interview round.
Thank you. Thank you. Yes, we can.
So my first question to you is, how are national programs implemented at different levels?
See, Government of India implement many national programs, and one of them is National Leprosy Eradication Program. So this is one of the important national programs being implemented by Government of India. So Government of India at national level, we have leprosy division, we call Central Leprosy Division. So Central Leprosy Division, they prepare the strategy for the implementation of the program. So once that strategy is developed, then at the state level, we have Joint Director Tuberculosis and Leprosy, and he is a program officer at the state level. And at every district, we have Assistant Director Leprosy, we can also call District Leprosy Officer. So this is the organogram for National Leprosy Eradication Program. So at each level, in addition to the doctors, we have non-medical supervisors, non-medical assistants. These are the pillars of the program who are responsible for detection of the leprosy cases, treatment of the leprosy cases, and follow-up required during and after the treatment. So this is how National Leprosy Program is implemented, and for the better implementation of the program, regular review of the program is being taken at national level, state level, divisional level, and district level also. So on monthly basis, the review of the program is taken to ensure that the program is being implemented as per the guidelines of the Central Leprosy Division.
Thank you for that answer. Going on to the next question now. My next question to you is, how are the national programs implemented at different levels? What are the vision and goal for NLEP?
The vision for the NLEP is leprosy-free world, leprosy-free India, and to achieve that vision, there are some goals which are to be achieved by 2027. So one of the major goal is zero leprosy case, zero transmission of the leprosy infection, zero grade 2 disability amongst child and adults, and zero stigma and discrimination of the leprosy patients. We know that the major stigma in leprosy is because of the visible deformity, that is grade 2 disability. So this is one of the major area we are focusing on to reduce grade 2 disability, and to reduce the grade 2 disability, we have to detect leprosy cases as soon as possible so that we can bring them under treatment. And once we start the treatment, we may break the chain of the leprosy transmission. So these are the goals which we have to achieve as a part of the national program.
Thank you for that answer. Now that you have explained the vision and goals for NLEP, the next question to you is, what is the target for elimination of leprosy?
Actually, Government of India Central Leprosy Division had decided to achieve zero leprosy transmission. So before that, we need to achieve elimination. At national level and state level, Maharashtra has already achieved elimination. That is one case per 10,000 population. In Maharashtra had achieved this elimination status way back in 2005. But there are many districts, not only in Maharashtra but other parts of India, which have prevalence rate more than 1. So as of now, Maharashtra have 20 districts. Out of 35 districts, we have 20 districts with prevalence rate 1 or more than 1. In Gadchiroli and Chandrapur, in Gadchiroli the PR is more than 5, and in Chandrapur the PR is more than 5. In Gadchiroli more than 6, and in Chandrapur more than 5. So if we want to achieve elimination at district level, so we have set the deadline 2025. By 2025, we want to achieve leprosy elimination at all the district level. So even though state has achieved that status, but as I said, district level, it is not achieved in all the districts. So by 2025, we will achieve leprosy elimination in all 35 districts. So after that, some districts may achieve elimination at district level, but there may be some blocks where the PR is more than 1. So at block level, we plan to achieve by 2026. By 2026, all the blocks in the state will achieve elimination status, and all the districts in the state will achieve elimination status by 2025. So this target is not only for the Maharashtra, but it is for all the states. This is the deadline given by Central Leprosy Division, and we are preparing plan to achieve the same.
Thank you for that insightful answer. We'll move on to the next question now. My next question to you is, what is zero leprosy transmission by 2030 per SDG, and what is the plan to achieve the same?
Right. So as per the Sustainable Development Goals, we are expected to achieve zero leprosy transmission by 2030. But Government of India had decided to achieve that status 3 years ahead of SDG deadline. So even though as per SDG we have to achieve by 2030, but Government of India has decided to achieve it by 2027. So what is meant by zero transmission by 2027? So we know the epidemiology of leprosy. The incubation period of average incubation period of leprosy is 5 to 7 years, and it ranges from 1 to 30 years also, or maybe below 1. So this is the incubation period of leprosy. But as per the SDG goals, in 2027 there will not be a new case of leprosy. There will not be transmission from leprosy positive patient to another person who is healthy person. So by 2027, we expect that there will not be transmission of the leprosy. There may be cases who might have had infection maybe 20 years back, so he may develop symptoms in 2027 also, because the incubation period is it varies from 6 months, maybe less than 6 months to 30 years. So by 2027, we expect that there should not be transmission of the leprosy. And for that purpose, we need to have very systematic planning. Government of India has released National Strategic Plan to achieve zero leprosy transmission by 2027, and that plan is released on 30th January. My Honorable Union Health Minister and Honorable State Health Minister, they have released National Strategic Plan on 30th January. So, based on the National Strategic Plan, all the states have to prepare their own state strategic plan. We are in process of developing a state strategic plan. Not only that, but we have also had 2 to 3 meetings with our district leprosy officers. We are developing district strategic plan for zero leprosy transmission by 2027. By March 2023, all our districts will have their own strategic plan so that they can achieve zero leprosy transmission by 2027. As I said earlier, before achieving zero leprosy transmission, we have to achieve the state level elimination of leprosy, district level elimination of leprosy, block level elimination of leprosy. So we will be achieving that by 2026, and by 2027 there will be zero leprosy transmission. So actually this is a very challenging task. We know the epidemiology of leprosy. There are no symptoms like tuberculosis. Patient most of the time person who might have leprosy, but he doesn't know that he has leprosy, and he don't have symptoms, so that he don't go to the doctors. So our volunteers, our health workers need to visit house and house, even though the family members don't know. They have some patches over their body which may suggest the leprosy, but they don't know. But our persons, our health workers, our volunteers, whenever they visit, they see entire body, the visual inspection of the entire body is done, and suspect patients are identified, and they are referred to specific facilities, and for then the diagnosis of the leprosy is done. So for achieving zero leprosy transmission, we need to have strategic plan at district level, state level, and national level. And not only this strategic plan will take us to the zero leprosy transmission, but there should be a robust mechanism for the review of the implementation and ongoing handholding of the persons or the system which is working at a village level and block level also.
Thank you so much for educating us about the policies of the government that are there in eradicating leprosy. Going on to the next question now. So my next question to you is, how leprosy can be integrated with other national programs?
So this is a very good question, because even though National Leprosy Eradication Program is a separate independent national program, but there are other national programs being implemented at national and state level also. Unless we integrate National Leprosy Eradication Program with other programs, we will not succeed in achieving zero leprosy transmission by 2027. Recently, we had one meeting at Ranchi on 12th and 30th January. That meeting was for integration of leprosy with National Mental Health Program, because we know that leprosy is such a disease where stigma and discrimination is very high at in rural areas, in tribal areas. In order to reduce this stigma and discrimination of the leprosy patient, this national mental health program is very important. Why? Because of the stigma and discrimination, the leprosy patient, most of the times they undergo depression. The depression is the most common mental problem being identified, which was discussed at our Ranchi workshop also. So most of the leprosy patient they undergo depression because of the stigma attached to the leprosy. And another is anxiety, also because of the leprosy. If people still they don't know there is a very effective medicine available for the treatment of the leprosy. If a patient take first supervisory dose of MDT, more than 99% of the bacteria gets killed. But still, people feel that if we touch the leprosy patient, we also may contract a leprosy. So there is need to have this is very systematic IC for leprosy. Another one is Rashtriya Swasthya कार्यक्रम across India. In this, for the examination of children, of doctor they visit and they screen these school-going children for different diseases. And one of the diseases is leprosy. As I said, you also aware that in the symptoms of the leprosy, most of the times the person who has the patches over his body or different suggestive symptoms, but they are not aware. So in such cases, the doctors are advised to remove the clothes of the children and
There seems to be a transmission issue at the doctor's end. We'll wait for the doctor to resume. There seems to be a network issue at the doctor's end. Welcome back, audience. Sorry for the disturbance. We had a network issue, and the doctor has resumed, and he's going to continue his answer now. Dr. Ramji, please go ahead and answer.
Yes, another national program.
Hello, Dr. Ramji, can you hear us? Sorry for the inconvenience. The doctor still seems to be having some internet issues. Yes, Dr. Ramji, can you hear us now? You're on mute right now, sir.
Yes. Hello?
Yes, I can hear you now.
Yes.
Please
So,
go ahead.
Adkekar is another program where we have integrated NLEP with that program to detect all the hidden cases in the community. So this is how National Leprosy Eradication Program is being integrated with different national programs for the early identification of the leprosy cases and immediate treatment of the leprosy cases. Yes.
Thank you for that answer. Moving ahead. So my next question to you is, what could be the factors causing delayed presentation in leprosy cases?
Yes. So actually, as I mentioned earlier, the symptoms of the leprosy are such that
So you're on mute right now.
As I mentioned earlier, the symptoms of the leprosy are such that patient, even though he has leprosy, but he feels that he doesn't have any disease. Because the symptoms, most common symptom is discolored patch over the body with definite sensory loss. So people don't know. So because of that, persons doesn't come voluntarily to the hospital, maybe primary health center or rural hospital. So because of that, there is delay in the diagnosis of the leprosy. But to overcome this problem, Government of India started leprosy case detection campaign from 2016. So this is the approach initiated by Government of India to identify leprosy cases as early as possible. In this campaign, we identify two members in a team. One is male, another one is female. These members, they visit each and every house in their jurisdiction, and there they examine all the members in the family. So female team member examine female members in the house, male member. So male member examine male members in the family. So in this way, am I audible?
Yes, yes. Please go ahead.
Yes. So in this way, both the team members examine all the members in the family for any patch over their body which suggest leprosy. So this has made a lot of difference in early detection of the leprosy cases. So if we talk this year, we implemented leprosy detection campaign during 13th September. During this period, we screened more than 8 crore people in Maharashtra, 100% of rural population and about 20% of the urban population was identified for this campaign. And we had identified more than 150,000 team members for screening such a huge population. And because of our planning and systematic implementation, we detected more than 6,700 leprosy patients during 14 days period only. So this is the approach which give results, and not only number of cases detected is important, but you must be aware that there are two categories of leprosy, possibacillary and multibacillary. In possibacillary, number of patches are less than 5, and multibacillary number of patches are more than 5. So our average multibacillary leprosy cases is 53%, but during campaign, the multibacillary were only 40%. So maximum number of patients detected, they were possibacillary, because we went to their houses, we examined them, even though they didn't have any problem, we examined them. So this is the strategy which really helped us to identify leprosy cases in early stage, and that made a lot of difference, and which is going to make lot of difference, and it will definitely help us in elimination of leprosy at district level by 2025 and block level by 2026. So these are the actual factors which were responsible for delayed diagnosis of the leprosy. But because of number of approaches, leprosy detection campaign is one approach. Another one is focused leprosy campaign. Focused leprosy means here we identify hotspots. Hotspot is the area where grade 2 disability case and child cases are there. In such area, we focus that area for the detection of the cases. We move our non-medical assistant, non-medical supervisors in that area, and we conduct house-to-house survey. So these are the different mechanisms we are adapting, which are giving better results for early detection of the leprosy cases.
Thank you so much for that detailed answer. We'll now move on to the next question now. So my next question to you is, what communication and social resources need to be developed in order to eradicate leprosy?
So for eradication of leprosy, only government machinery cannot achieve eradication or even elimination at a district and block level also. We definitely need community participation. Unless we get community participation, we will not be successful in elimination or eradication of the leprosy. But the major point is how we communicate with our community to get their support. The first thing is that still people, so most of the people, they don't know that leprosy is curable. There is very effective drug for leprosy, which is freely available in all government health facilities. It may be primary health center, rural hospital, in all these facilities, and it is freely supplied. So there is no issue of shortage. World Health Organization supply all anti-leprosy drugs free of cost to all the states. So that's why drugs are freely available. Only thing is that people need to understand that leprosy now is not a disease which is not curable. Leprosy is curable. Even there are many newer initiatives being taken by Government of India to reduce the stigma. One activity is Sparsh Leprosy Awareness Campaign. This campaign is done only for reducing stigma and discrimination with leprosy patients. on 30th January, death anniversary of Mahatma Gandhi ji, that day is celebrated as Anti-Leprosy Day across India. And on that day, Gram Sabha are being organized in all the Gram Panchayats. In that Gram Panchayat, our health workers, they give information about the leprosy, how leprosy is caused, how it gets transmitted, what is the drug available, where the drugs are available. All the information is given. So Government of India identified school-going girl that named as Sapna as a mascot. So with the help of school-going children, with the help of Gram Sabha, we are trying to reduce the stigma and this leprosy. Yeah, definitely, these new initiatives which are being taken by Government of India, that is definitely helping us to reduce the stigma and discrimination. But only one day will not be sufficient to reduce the stigma and which is attached with the leprosy. For that, we are implementing fortnight. So that is from 30th January to 13th February. During these 15 days, we are organizing different activities in all the villages at sub-center level, at PEC level. We have prepared a IC plan also. Different IC activities are also implemented across Maharashtra and across India to reduce the discrimination and stigma with the leprosy. And there is definitely political commitment is also seen because of the Government of India's initiative. There is political commitment from our side. Honorable Health Minister of Maharashtra has written to all the guardian ministers in all the districts to support leprosy. And because of that, there is political commitment, there is administrative commitment, and there is community participation, which definitely help us to achieve zero leprosy transmission by 2027.
Thank you for that insightful answer. It's always good to know what is going on, what the government is doing in rural areas as well as in the urban areas to eradicate leprosy. My next question to you is, what steps need to be taken to move from a curative to a preventive approach for leprosy?
For eradication of any disease, there should be strategy for prevention of the disease and strategy for curative approach. And the main problem with leprosy was that there was no major advance for the prevention of the leprosy. But 3 years back, Government of India started post-exposure prophylaxis. This is for the contacts of the leprosy patient. Government of India initiated it, and for all the contacts of eligible contacts of all the leprosy patients, we give single dose of rifampicin. That is SDR, single dose rifampicin, to all the eligible contacts. The protection of this SDR is 60%. So after initiation of the Government of India, so WHO also accepted a single dose of rifampicin for the prophylaxis. But the protection level is, as I said, 60%. But most important will be the vaccine for the leprosy. So that MRP vaccine is under trial. Mycobacterium indicus rani. This is this MIP vaccine. It is under trial. Maybe in next 6 to 8 months, it will be part of the national programs. So Government of India is trying to start that vaccine for the contacts of the leprosy patient. once we get this, definitely we can ensure these contacts, they will not contract leprosy. So basically, our focus right now is with the single dose of rifampicin and early identification of the treatment, immediate initiation of the treatment, complete treatment, and follow during and after treatment. But once we get leprosy vaccine, definitely we can move from this approach to the preventive approach, and we hope very soon we will have that.
Thank you. Thank you for that insightful answer. Moving on to the next question. So my next question to you is, what should be the best standard for assessing the quality of life for people with disability due to leprosy?
So actually, I cannot tell as an authority on this, but as per my knowledge, whatever references I have gone through, I feel that World Health Organization's quality of life scale, that can be one of the better scale for measuring the quality of life of patients, leprosy patient with grade 2 disability. So as you know, there are four domains of this scale. They are physical health, psychological health, then social relationship, and environmental health. So these are, I think that these are the four domains through which we can measure the quality of the life of leprosy patient. As I once, in one of the question, I already given the reference of the National Mental Health Program. Why it is required integration with NMHP is that in leprosy patient, most of the times they undergo depression, and there are suicidal tendencies also. But I think these are the four domains on the basis of which we can measure the quality of the life of the leprosy patient.
Thank you for that insightful answer. Moving on to the next question. So my next question to you is, are there any, since you already spoke about vaccines and all that, so I just wanted to know, are there any vaccine, leprosy vaccine under clinical trial, and which we could see soon?
Yes, that is the vaccine I was talking about, the MIP vaccine. It is under trial already under the guidance and supervision of Central Leprosy Division. 2 states are already doing trial for that. I think that study is also available with Central Leprosy Division. I think Government of India will soon take a decision. So I cannot give the deadline, but definitely it is under the Central Leprosy Division and Government of India. Very soon decision in this regard will be taken. Because if we really want to achieve zero leprosy transmission, we need to have a vaccine, and we hope that very soon we will have a vaccine against leprosy.
Thank you for that answer. Moving on to the next question now. So my next question to you is, since you already spoke that mental health and leprosy sometimes go hand in hand, so what is the psychological impact of leprosy in affected individuals?
Right. This mainly whatever studies have been conducted, whatever discussion taken place at the Ranchi workshop, that, as I said, that workshop was only for the integration of NLEP with the NMHP, National Mental Health Program. So most of the experts in mental health program, they said depression, anxiety, suicidal tendencies, these are the major mental problems observed in leprosy patient. So actually, the main reason is grade 2 disability. Only because of the disability, these patients have guilt about themselves, and because of that, most of the times there are suicidal tendencies. But in next 2 months, we will have very good document, and based on that document, all the states will be implementing NLEP in very close coordination with National Mental Health Program. Right from the detection of the leprosy case, there is integration with National Mental Health Program at block level, at district level, at state level. And I think once it gets systematically implemented, this issue can be very well addressed. Maybe next 2 to 3 months, we will have the final document on this.
Thank you so much for that insightful answer. So moving on to the next question now. So my next question to you is, what was the possible impact of COVID-19 on leprosy patients?
Really, COVID pandemic has made impact on all the programs, and NLEP is not different from that. So in 2019-20, Maharashtra had detected more than 16,000, to be specific, 16,500 new leprosy cases in 2019-20. But during COVID in 2020-2021, we detected only 12,500. So there is around 20% drop in leprosy cases in 2021 as compared to 2019-20. So this was the impact of the COVID, because people were not moving out of their home. Even for health workers, there were limitations because of the restrictions of the COVID. So because of that, many hidden cases remained in the community. Again in 21-22, we detected more than 14,000 cases. But this year, in 2022-2023, in first 9 months, from April to December, we detected 16,000 cases. This is because we could detect.
Oh, we cannot hear you. No, I cannot hear you now. We can hear you now. Hello, Dr. Adkekar. Hello, Dr. Adkekar. I can hear you. Yes, I can hear you. I can hear you, sir. Hello.
Recording in progress.
I can hear you, sir. Yes, I can hear you.
So definitely there was negative impact of COVID pandemic on leprosy. Basically, that impact was on detection of new leprosy cases. So, as I said, there was around 20% decline in new case detection in 2020-2021 and around 10% decline in 2021-22. But we have detected all the hidden cases during 2022-2023. This year, we will be detecting around 20,000 new leprosy cases.
Thank you for that answer. Moving on to the next question. So, what are the recent advances in leprosy diagnosis?
So up till now, our diagnosis was focused on mainly suspect identified by our ASHA, non-medical assistant. They used to see patches over the body, and then they used to refer these suspect cases to primary health center. And at primary health center, rural hospital, a doctor used to test their sensation, and then he used to diagnose. In some difficult to diagnose cases, we used to do slit skin smear. But recently, in our meeting, which was held in December 2022, so Government of India will be using NAT facilities, molecular testing facilities for leprosy also. Up till now, it is commonly used for the diagnosis and universal drug susceptibility test in tuberculosis. But similarly, these NAT machines or molecular testing facility will be used for the rapid diagnosis of the leprosy, confirmed diagnosis. We hope in next 5 to 6 months, maybe these newer technologies will be used for the diagnosis of leprosy case also.
Thank you for that insightful answer. Moving on to the next question. So, are there alternative treatment regimens more effective than the multi-drug therapy?
So actually, when we work in a government system, actually we implement only those guidelines, those strategies given by Central Leprosy Division. So as of now, we see that multi-drug therapy is a very effective drug combination for the treatment of leprosy. But there may be microbial resistance for the these anti-leprosy drugs also. But Government of India recently released guidelines for monitoring of the resistance to these drugs. These guidelines released on 30 January also. On 30 January, guidelines are already released. But to be frank, I don't know which are other alternative drugs because, as I said, we talk about those drugs which are as per the guidelines of the Central Leprosy Division.
Sure, sir. Thank you for that honest answer. So, moving on to the next question. So, one of our doctors wanted to know that how could they contribute? This question is from the community, actually, community of doctors. So they wanted to know how could they contribute to this leprosy cause, and they also wanted to know about how to deal with the dilemma, especially with the pre-existing diabetes, the dilemma in diagnosis. Yes.
First question is, everyone can contribute as per his capacity. First is IC. IC for leprosy is very, very important. Still, people feel that leprosy is not curable. Once a person, leprosy patient has grade 2 disability, then he should not be a friend, he cannot be a family member. So leprosy, the diagnosis is now easily done. Treatment is available free of cost. It is available at all the health facilities. It is available in abundance. So if anyone want to contribute, he can educate people in his geography, maybe a village, block. He can give scientific information regarding leprosy and treatment available at government facilities that is free of cost, and for the entire period of the treatment. Now we are conducting anti-leprosy fortnight. Different activities are being conducted at schools level, college level, gram panchayat level. Different strategies are being used for the awareness about the leprosy. This is regarding your first question. Actually, for the diagnosis of the leprosy, the only thing is that we need to educate them or educate the community. So any patch or any part of the body, that should be suspected as a leprosy case. Then at PSC level, at RH level, our doctor will examine and he will decide whether it is a case of leprosy or not. But what happens, it is not possible to examine each and every person every month. But family members, they can check whether any member of their family has suspected patches of leprosy over his or her body. Once that is being practiced, I think then definitely we can diagnose leprosy in earlier stages. The identification of suspect leprosy is most important. So even though there is a system, but if family members practice in this way, then definitely that will be very useful for the confirmation of the leprosy and immediate treatment of that.
Thank you so much for that answer. And do you have any takeaway message for the audience here?
First of all, I would like to thank you for organizing this interview. Most of the times, state government of India implement many national programs, many new initiatives, but it remains with government system only. But if you really want to disseminate the information, what the government is doing, this is one of the good platform. So that's why I would really like to thank you. But I really appreciate your audience. If they are thinking that they should contribute for the zero leprosy transmission by 2027. So each one of us can educate the community. We can build confidence in the community that even if you are diagnosed with the leprosy, there is effective medicine, and that medicine is also free of cost, and government is committed for the zero leprosy transmission by 2027. And for achieving this goal, definitely we want to request all of you to support this important cause so that we can eliminate leprosy and we can achieve zero leprosy transmission by 2027. Thank you.
Thank you so much, Dr. Ramji. We are sure that our audience knows a little more about leprosy, what the government is actually doing at rural areas and urban areas. So it was a very nice talk. It was wonderful listening to you. Thank you, Dr. Ramji, for your time and effort in putting together this interesting session. To our dear viewers, thank you so much for attending this session. Share any more questions if you have. Until we see you again, take care and happy dog flexing.
Thank you. Thank you very much.